Seeing the rising COVID-19 cases in the country, people are pinning their hopes on the vaccines. But on the one hand, we can see that some vaccines are causing blood clotting cases. We also got to see some extremely deadly and dangerous side effects too. But on the other hand, we can see that the people who are vaccinated are even catching COVID infection. After all this, you must be wondering whether the vaccines are safe or not, or you should take it or not. So the simple answer to that is yes, our vaccines are safe and effective and everybody should get vaccinated. So how do I make such a claim? For that we need to understand the role and mechanism of the vaccine. Through vaccines, a weak or dead virus is administered to your body so that your body learns to defend itself against the virus. Your body does this by producing antibodies. Once your body learns to fight against a weakened virus, it becomes easier for your body to produce antibodies in case of an actual infection. A vaccine is similar to a practice test which prepares you for the final exam, but no practice test can prepare you 100% for the exam. Similarly, a vaccine cannot offer you 100% protection against a disease. So there are several vaccines in the world. You can notice that none of them are 100% effective. There are 2 vaccines in India and the third one has been approved, but they aren't 100% effective too. This means that you can still catch COVID-19 even if you are vaccinated. This is known as a breakthrough infection. To understand this at a deeper level, we need to first know the difference between an infection and a disease. We often use these words interchangeably, but these words hold different meanings. An infection is the first stage of any disease, when a harmful bacteria or virus enters your body and starts replicating. A disease is caused when this bacteria or virus start attacking your body. You will become ill and start showing symptoms like cough and cold. Thus, an infection is caused when a virus or bacteria enters your body, and disease is caused when the microorganism starts attacking your body. This means that you can get infected without falling ill. This is the position with the people who are COVID positive but are asymptomatic. When vaccine trials are conducted, participants are divided into 2 groups. One group receives the vaccine while the other group believes that it has received the vaccine but had not. This is called a placebo. Over the time, scientists check for those who show the symptoms of COVID-19. If the number of patients is lower than the vaccinated group, the vaccine is effective. Thus, a vaccine measure if you are sick or not. It doesn't measure if you are infected or not. To measure the infection, everybody needs to be tested, but scientists test only those who show the symptoms. This tells us that even after getting vaccination, you can get infected. And the second question is, why do people get sick even after getting vaccinated, and some people even die too? How does this happen? Erin Bromach, an American immunologist, suggests that vaccines are similar to dams. No dam is 100% effective. When a load of water is high, the dam could break. The same is true for vaccines, hence the term breakthrough infections was coined. Experts argue that breakthrough infections occur in the environment where several COVID cases are present. So if you are vaccinated and live in India, you are more likely to catch COVID infection as the country is recording lakhs of cases per day. Other than the number of active cases in an area, there are several other factors which are responsible for breakthrough infections. For example, an immunocompromised individual is more likely to catch COVID infection as he don't have a strong immune system. These are the people with medical conditions like HIV, cancer or diabetes. Thus, even if they are vaccinated, they can contract COVID-19. You are not 100% protected even if you have received both the doses of vaccines. It takes 2 weeks for your body to get immunized. If you have recently received the first or second dose of vaccine, you can test positive for COVID-19. Though vaccinated individuals can get breakthrough infection, but there is a positive news. Breakthrough infections aren't as fatal as normal infection contracted by a non-vaccinated person. Israel conducted a study of 5,000 patients, which included patients who are vaccinated and those who are not. The result shows that when vaccinated individuals get COVID infections, the load of virus in his or her body is lower. That means the symptoms of COVID-19 are lower too. Researchers have discovered that when you get vaccinated, you are less likely to contract a fatal infections and transmit the virus to others. That's why researchers have suggested to get vaccinated, because it not only do good for yourself but also for the people around you. Researchers caution that no vaccine is 100% effective. So even after getting vaccinated, you shouldn't stop wearing masks and follow the COVID-19 protocols, because the more you expose yourself to the virus, the more you are likely to catch the breakthrough infections. That's why a Hyderabad-based doctor suggested that vaccines can't prevent the virus from entering into your body, but it can help to fight the virus once it got into your body. So only masks can block the virus from entering your body. The ICMR of India is trying to understand the breakthrough infections. According to ICMR, in every 10,000 people, only 2 or 4 people are contacted by breakthrough infections. That is a very good news because breakthrough infections are rare. But many have questioned the data. For example, India Spend revealed a report that government don't have enough data to study the breakthrough infections. The vaccination program in India was started in January 2021, but until 7th April, test center didn't ask the patients whether they were vaccinated or not. So if the forms were changed after 7th April, what about the people who were vaccinated and tested positive between January and April? The ICMR doesn't have data about it. Studies conducted in other countries like America shows that breakthrough infections are fairly low. But can the COVID vaccine cause infections or even death? That is not the only question raised against the vaccines. Many questions have been emerged in the world of WhatsApp. Many claim that AstraZeneca Covishield cause blood clots, though it is observed in many people, but experts suggest that the risk is very low. So despite the risk, you should get vaccinated. The main reason behind the second wave in India is the lack of vaccination among its citizens. As of now, only 2.7% of the population have got both the doses of vaccine and 10% have got their first one. So if India wants to achieve the herd immunity, a stage when the spread of virus is minimal, India had to vaccinate 70% of its populations. But at the pace which we are going, it would take around 16 months for the people to get for their first vaccines and around 9 years to get both the doses. There are two reasons for this slow pace, the demand side and the supply side. The supply side indicates the shortage of vaccine stocks in India. That's why India has banned the exports of vaccine and approved a third one. It's the job of the central and state government to provide us vaccines, but it's our job to get vaccinated. Everyone above the age of 18 can get vaccinated, thus you have to follow these two steps. First, register yourself at the CoWIN portal for vaccination shot. Second, convince everybody around you to get the vaccination. It's not only crucial for them to get vaccinated, but for the people around them too. But if you know somebody who is reluctant about taking the vaccines, then share this video with them too.